right now, Dr. Dan Seigerman, hand and wrist surgeon at Rothman Orthopaedics in New York, and get his thoughts on some of these Yankee injuries. Doc, Mark Malusis, Maggie, Gray, thanks for a couple minutes this morning.
Thanks for having me. Nice to talk with you guys.
Nice to chat with you as well. Let's start here with LeMahieu. Positive news. No ligament damage, nothing broken with the thumb injury, doctor. But when you look at this injury, is this something 3 weeks that he'll be 100% A-OK? Is this something that, from your expertise, that could linger here for DJ LeMahieu?
Yeah, great question. So, I'm not personally involved in his care, but in general, sprains of the thumb are super common. And it is very important to distinguish between a sprain and a full tear of the ligaments of the thumb. In the case of a sprain, oftentimes we immobilize these for about 3 to 4 weeks in a brace or a splint, and then they're doing pretty well. And if they're stable, meaning that there's no instability at the level of the thumb, they actually can go back fairly quickly and do quite well. It's those patients that have more of a tear of the ligament that we worry about, and those patients can sort of have long-term sequelae often, and in some cases needing surgery.
Dr. Seigerman, is this the type of injury that's easy to re-injure? Like if you injure and sprain your thumb, does it become now maybe more likely you'll re-sprain it, in a short amount of time, or is there no correlation there?
Well, if it's a sprain and it heals completely and we get them back to, full throttle, they usually do quite well. And, there's no real good data to support that they're going to have a recurring problem with that. It's those patients where they may have a small tear, and those that you miss, along the line, where it can be more of an annoying problem on and on. So that's what we look for.
You're not working with LeMahieu, obviously, but dealing with that, the information that you do have, Doc, in the span of 3 weeks here, you think that's a realistic timeline to see him back with the Yankees, give or take a day or two, and back in that lineup?
Yeah, I think it is. Oftentimes, the best thing that we have at our disposal is our physical exam. So if a patient comes in and they have no major instability of the thumb, just some discomfort, that's often a sprain. And if there's imaging to correlate that, that's great news. Oftentimes, patients go into a splint for 3 or 4 weeks, and we see them back on the field competitively during that time interval. The most important thing is going to be monitoring him and examining him on during his course of treatment. If there's residual discomfort, that may be a setback, but it's not uncommon for these patients to get back reasonably quickly within the 3 to 4 week time period.
Dr. Dan Seigerman is our guest, hand and wrist surgeon at Rothman Orthopaedics. In terms of this season, it's been very different, obviously, with the abbreviated summer camp, spring training 2.0, whatever you want to call it. And now we are seeing, an abundance of soft tissue injuries. In your opinion, do you think that has anything to do with the quick ramp up back into the season, or completely unrelated and just sort of how things go in professional sports?
I think it's a great question. I actually think it's something that we're going to look at after the season and in future seasons. Professional athletes, and we take care of lots of professional athletes, they are a fine oiled machine. And so they require a very, very stringent preseason workout course and a continuation during the season. So we're not really sure how this shortened season will play out, but certainly we're going to learn from it, and we're going to do some research and to see how we can improve things going forward, hopefully when we get a full season.
Doc, I know it's not your specialty, but when I ask you about Stan, Maggie and I were just having a conversation, obviously dealing with a hamstring injury, a week out now, 3 to 4 weeks was the initial diagnosis. The healing process, obviously every athlete heals a little bit differently. When you look at Stanton, and he showed his frustration yesterday with it, how about dealing with a hamstring injury, a grade 1 strain of that hamstring, coming back from that, and at times, with him in particular, those lower leg injuries have a tendency to linger.
I think that's exactly right. I mean, hamstring injuries are very variable, as you mentioned. Depends on the grade of the strain, and it depends on the person. In some instances, they can certainly linger either from season to season or from one injury to another. So I think you're right on the mark with that.
Is there anything that you would suggest to a patient where, they can try to mitigate some of these lower leg injuries, especially and specifically for baseball players?
Yeah, I mean, professional athletes are a certain variety, but we tell patients all the time the most important thing that they can do is to stretch and prepare for whatever athletic endeavor they're involved with. So stretching and knowing their body and working on proprioception, either with a formal therapist or doing it on their own, is exceedingly important for the long-term durability of the patient's body. So we really hone in on a lot of that, pre-sport stuff.
What about the Yankees' decision with Judge, putting him on the IL over the weekend? He said he's 100% healthy. You like the conservative decision by the Yankees to try and make sure to try and cut a significant injury off at the knees and being very, very careful with their star?
Yeah, obviously I'm not involved with his care either, but, these are judgment calls. And, in general, patients really know their body, and athletes certainly know their bodies best. And probably that's a decision-making endeavor between the player and his managing squad. So my feeling is it's probably a good one to hold him back just a bit and until he's absolutely positively ready to go. Yankees are doing pretty well right now, so they do have that luxury. But in general, patients know their body, and certainly professional athletes know it quite well.
Dr. Seigerman, a last question for me, and this is away from the Yankees, right? This is just a treating professional athletes question that I have for you. You're treating a patient, and have you ever had a team come to you who's maybe asked to make a decision on whether or not to pay an athlete a huge contract and come to you and say, do you think this is going to hold up? Do you think he's going to hold up? Has that ever happened in your professional career?
That's a tough question. It has never personally happened to me, but I'm sure that that sort of situation does happen. These teams are investing money and talent into these players, and they're going to do their due diligence to make sure that the players are what they're supposed to be. But personally, in my opinion, anything can happen to anybody. And it's very, very important to guide the player through the preseason workout and be comfortable with that process to mitigate any of these injuries as possible. It's a little hard to have a crystal ball and make a decision on somebody's health long term, given the fact that they're a major league athlete or a professional athlete.
Do you buy
great question.
Oh, I'm sorry. Do you buy into the idea of being injury prone? Is that a real thing in the medical profession?
I think some people are injury prone to a certain extent, people who have repeated injuries, specifically in the same limb. I think it's important to discern between someone who's injury prone and someone who hasn't fully recovered from initial injury. And I think those are two very distinct problems. Oftentimes, one of the hardest things that we as physicians and orthopedic surgeons have to deal with are allowing a player, whether it's a high school player, a collegiate player, or even a professional player, making that decision when it's safe to go back. And we do so to protect the patient or to protect the player. But sometimes, people go back a bit too soon, and that can sort of lead to a lagging problem.
Dr. Dan Seigerman, hand and wrist surgeon at Rothman Orthopaedics in New York. Doctor, thank you so much for the time this morning, your expertise. We appreciate it, bud.
Thanks so much for having me. Great talking to you guys.
You got it, you as well. So good news there from his perspective, even though he's not working on the case that, and he's not his patient, that from what he understands with LeMahieu, that 3 weeks he should be good to go. No ligament damage, nothing broken after the MRI. He got that second opinion. That news came out yesterday. All good for DJ LeMahieu, as we talked about, an irreplaceable piece for this Yankee team. A lot more to get into.
Hold on one second, Moose. We got to mention that Dr. Seigerman, hand and wrist surgeon at Rothman Orthopaedics, is the official orthopedic of the Yankees radio network, with locations in Tarrytown, Harrison, Gramercy, and opening soon on Madison Avenue. For more info, go to rothmanny.com.